Botox was originally intended for people with crossed eyes, and case studies soon followed that showed it also had great benefits for stopping muscle spasms, specifically on the face. A common bad Botox result is the Spock brow, where the tail of the brow is unnaturally high and spiked and the medial brow is unnaturally low. And for the crow's feet area, if Botox is injected in a pattern that lowers cheek elevation, one can get a look of hollow eyes and chipmunk cheeks. Brows can be a main area that showcase when something isn't right, as can the mouth. If your eyebrows have dropped into your eyelashes, you look like you are auditioning for the next Star Trek, or your mouth is drooping, you've had bad Botox. These are miserable things that can happen from incorrect or overdosage of neuromodulators. They are not permanent, but can be debilitating while you have them. Botox injections are shots that use a toxin to prevent a muscle from moving for a limited time. These shots are often used to smooth wrinkles on the face. They are also used to treat neck spasms, sweating, overactive bladder, lazy eye and other conditions. Botox shots also may help prevent migraine. The medicine in Botox injections is made from the same toxin that causes a type of food poisoning called botulism. But the forms of purified botulinum toxin used by licensed healthcare providers meet medical control standards. These standards were approved by the U.S. Food and Drug Administration. As a rule, the bacteria toxins used for medical purposes are not harmful if used correctly. Botox shots block certain chemical signals from nerves that cause muscles to contract. The most common use of these injections is to relax the facial muscles that cause frown lines and other facial wrinkles. Botox injections also are used to ease symptoms of some health conditions. It's not a cure. Examples of medical conditions that might be treated with Botox injections include neck spasms. In this painful condition, the neck muscles contract in an uncontrolled way. This causes the head to twist or turn into an uncomfortable position. The condition also is called cervical dystonia. Other muscle spasms, cerebral palsy and other conditions of the nervous system can cause the limbs to pull in toward the center of the body. Muscle spasms also can cause eye twitching. Lazy eye. The most common cause of lazy eye is an imbalance in the muscles used for moving the eye. Lazy eye also is called crossed eyes or misaligned eyes. Sweating. Botox might be used for a condition in which people sweat a lot even when they're not hot or working up a sweat. It's called excessive sweating or hyperhidrosis. Migraine. Botox injections may help reduce how often you get a migraine. This treatment is used mainly for people who have headaches 15 or more days a month. When you get serious headaches that often, the condition is called chronic migraine. Treatment is needed about every 3 months to retain the benefit. Bladder problems. Botox shots can also help reduce urinary incontinence caused by an overactive bladder. Botox injections are usually safe when you are under the care of a licensed and skilled healthcare provider. The procedure can result in unwanted results or even cause harm if it's given incorrectly. Possible side effects and unwanted results include pain, swelling or bruising at the injection site, headache or flu-like symptoms, droopy eyelids or crooked eyebrows, a crooked smile or drooling, watery or dry eyes, infection at the injection site. Rarely, the medicine may spread to parts of the body where it isn't supposed to go. It can cause symptoms there. Call your healthcare provider right away if you have any of these symptoms hours or weeks after your procedure. Muscle weakness, vision problems, trouble talking or swallowing, breathing problems, allergic reaction, loss of bladder control. As a rule, healthcare providers don't recommend Botox if you are pregnant or breastfeeding. Select your healthcare provider carefully. Botox is a prescription medicine and must be used only under the care of a licensed and skilled healthcare provider. Talk with your healthcare provider about whether the procedure fits your needs. To find an expert in Botox injections, ask for a referral from your primary care provider. How you prepare. Which type of botulinum injection is right for you depends on your needs and condition. Talk with your healthcare provider about the treatment best suited to you. Tell your healthcare provider if you've had any type of Botox injection within the past 4 months. Also tell your healthcare provider if you take blood thinners. You may need to stop taking them several days before your injection to reduce the risk of bleeding or bruising. Talk with the healthcare provider who prescribes these medicines as soon as you can. Botox is approved for anyone 18 and older, but that doesn't necessarily mean you need to storm into your closest Botox center on your 18th birthday. The best time to start Botox is whenever you begin to see any fine lines or wrinkles appear on the skin. This normally happens around a person's mid-20s or early 30s. What you can expect. Before the procedure. Most people don't feel much pain during the procedure. But you may want your skin numbed beforehand, especially if your palms or feet are being treated for heavy sweating. Your healthcare provider might use one or more of the following methods to numb the area: anesthetic applied to the skin, ice and massage. The massage method also is called vibration anesthesia. Botox injections are usually performed in a medical office. Your healthcare provider uses a thin needle to inject tiny amounts of botulinum toxin into your skin or muscles. The number of shots needed depends on the size of the treatment area and other things. Sometimes ultrasound is used to guide the needle to the right spot. Some famous personalities like Sharon Osbourne admitted to having Botox on her talk show in 2003 and got the procedure done in front of a live studio audience. The Real Housewives of Orange County star Vicki Gunvalson is seen getting injections in the show's opening credits in 2006. In Joan Rivers' 2008 book, Men Are Stupid, and They Like Big Boobs, A Woman's Guide to Beauty Through Plastic Surgery, she dubbed Botox a miracle in a needle. Allergan's sales reflected this rapidly growing desire for the treatment. According to the company's Securities and Exchange report from 2003, they made $439.7 million in net sales from Botox in 2002. In 2003, sales rose to $563.9 million. In total, over 100 million vials have been sold in the United States since 2002. It was originally intended to treat an eye condition called strabismus in the medical world. Dr. Alan B. Scott was the first person to use Botox for medical purposes. At that time, it was called oculinum. In his research to find a non-surgical protocol for children with strabismus, a condition in which the eyes are not aligned properly, Scott was looking for therapy that had a couple of key characteristics. It would be used locally injected, and lasts long enough for a therapeutic effect, but was not permanent. The Botox look. Have you ever wondered why a lot of people, that includes rich people, rich and famous people and the middle class go for this look? Especially in this era of social media, influencers, Instagram, modeling, etc. Botox is one of the world's most recognized cosmetic drug brands, and it is soaring amongst millennials. Latest research from the British Association of Aesthetic Plastic Surgeons (BAAPS) found requests from 19 to 34-year-olds for Botox and filler rose by 41% between 2011 and 2015. In the US, where Botox has been the most popular aesthetic treatment for 20 years, procedures among the same age group had increased by 87% in the 5 years to 2018, with more of the selfie generation booking preventative Botox to beat wrinkles before they've even appeared. But the UK's non-surgical cosmetic industry, which is said to be worth over £2.75 billion, is also largely unregulated, meaning treatments can be administered by anyone, anywhere. We might think we have a decent idea what Botox does now, and we're all aware that social media pressure and reality TV has played a massive part in the boom. But there has also been a rise in the number of patients being dangerously misinformed. Following Superdrug as £99 Botox service coming under fire, and claims that the cosmetic industry wasn't doing enough overall to help vulnerable patients, particularly those with body image obsessions. Tighter controls have recently been brought in to protect young people as mental health. In future, the Joint Council for Cosmetic Practitioners (JCCP) says staff of its member clinics will be trained to screen patients for mental health issues before administering Botox and fillers, directing anyone vulnerable to nearby NHS services. Needles might be rife for Gen Z and millennials. But with Botox drive-thrus and a longer-lasting E-type 2 toxin on the horizon, what do people who've been taking facial freezing measures for more than a decade have to say? Guys, what are your thoughts about Botox? Are they necessary or not? Feel free to express your thoughts in the comment box. Don't forget to leave a like and subscribe to this channel. Don't forget to share this video to your friends and loved ones if you found it useful. See you in our next upload.